Hello and welcome all. I am Dr. Kiran.
And I'm Dr. Sirish Nelivigi.
So today we are going to discuss about the growing concern of a very important issue which is becoming a big problem among the young children and young adults as well. And this is nothing but the digital eye strain. So what is digital eye strain? Digital eye strain is something which happens or is experienced by the children when they are continuously looking at the screens, be it computers or laptops or the iPads, etc. So what happens is when the child is continuously looking at the screen, the blink rate tends to come down, and it is like continuous focusing at a very close distance. So it causes digital eye strain, and the child may suffer from headaches or dryness of the eyes or just irritation to begin with.
Correct, yeah. Some of the patients actually may even have mild redness of the eyes as well, just to add up, and watering of the eyes is possible. One of the important things I think probably happens as a part of digital eye strain is something we call as restriction in accommodation. Accommodation is, all of us as humans, we have this ability to bring things into focus, to bring things inside focus and outside the focus, so we can adjust our gaze however we want. However, when we are onto digital screens for a very long time, this tires our muscles out. So the muscles, there are very tiny muscles in the eye, and when these muscles get tired, they don't function the same way as they should normally do, and as a result even the accommodation gets affected. In fact, this can be one of the primary reasons why people end up with headaches. Headaches can be usually in this area, and then something we call brow ache also. Some of the people may have pain here. So when they concentrate for a long time, they end up with pains like that. So dryness is again an outcome of the same thing, and the whole picture, what when you put together, we bring it under the definition or categorization of what we call as digital eye strain. Now that we are using quite a lot of us, according to a survey, we end up using some kind of a digital device, almost something like around 6 to 8 hours a day, even in people who are not software engineers or not with computers. If we talk or include the software engineers in this statistics, then the amount of digital usage crosses 14 to 16 hours a day.
So yeah, we do see lot of kids as well as the young software professionals or even normal people who are into too much of mobile usage nowadays. So it has been seen then when you are continuously looking at the screen, your blink rate comes down because we are continuously staring at the screen, and as we all know that those things are designed in a way to make us get glued onto the screen. So the blink rate comes down, which causes the dryness. And
do you see quite a lot of such patients, madam, in your practice? You've been seeing a lot of
yes, we
such
do see a lot of patients, and some of them it takes a long time to let them know that what is happening actually and how can they get over this problem.
So it's quite a common thing to
It's
see.
a very common thing.
You've been practicing almost for 30 years now. Do you see a pattern in the change of the problems due to the digital eye strain? Say in your long years of practice, say how was it, say 20 years back, for example?
Yeah.
How common was it? Or
20 years back, like mostly the pediatric population would be coming mostly for refractive errors, that they were not able to see things. But nowadays we do see kids, like the parents are so concerned that my child is just blinking and they are making very awkward movements with the eyes. So they are sometimes even concerned, is it any neurological problem or something? But on general checkup, we sometimes just find that just like prescribing simple lubricating eye drops tends to clear the problem. So yeah, these screen has become a big issue for the children.
For me to try to detect the digital eye strain, what I normally do on examination is, apart from the history plays a very, very important role in trying to identify whether there is digital strain. So as we already discussed, headaches, blinking, eye strain, inability to focus, these form some of the symptoms in us to pick up. We can also pick it up on something we call as slit lamp examination. There is something called as a tear meniscus height, and I usually use this simple thing called tear meniscus height, and then we see the tear film. Quite a lot of these patients with digital eye strain do tend to have a lower height of the tears or thickness of the tear film. Some of them even come with mild redness of eyes. We have to try to differentiate this from the infections that they get. But it can be done. It's not a big deal, because this kind of a redness is usually has a different pattern and is doesn't come with like the sticky discharge that a conjunctivitis comes. So that's how I'll be able to do. I think this should form the list of tests. Do you think anything else to be added up? Would you run them through some dry eye evaluation? Would you want to examine? How would you approach?
So I would also pay attention to the lid margins of the child, because sometimes we have those glands, the glands which secrete some oily secretions, they also tend to get blocked. So earlier we would see this problem only for very elderly people, right sir? But nowadays it's so common even with the young kids, just because of staring at the screen. So that does cause a lot of dryness and the frequent and disruptive eye movements in children.
The treatment of it is quite difficult, no? I mean, we have been finding sometimes it's pretty, some of those simpler situations, or rather situations where we identify them early, it's a fairly easy thing to treat. Why I am saying the treatment is not so simple is because there are two parties involved here. So it's not enough that we as clinicians treat the dry eye and then the job is done. Like say for example you have a viral or a bacterial infection, you give whatever antivirals or bacterials and then the job is done.
Yeah.
But however, treating digital eye strain requires a lot of input and effort, not from the clinician or from our side alone. It requires a lot of effort even from the side of the person who has it. And that is the bigger part of the treatment, unfortunately.
And in case of children, even the parents are involved. Correct. So it's sometimes very difficult to convince them that it's not something very big and it's just a small thing which can be tackled just by regulating the screen time for the child. Education about the right habits.
Yes. Yeah. So otherwise, how would you take up the treatment? At least let us say from our side, our perspective as clinician, how would you treat a child with digital eye strain? Let us talk about probably what the parents can do. So what is it that you would do for a child with a digital eye strain? Probably I can put in my points about like how we approach in adults.
One thing we can tell the parents is to be little strict about the screen time. In a day, just regulate it to 1 hour or something and split it between half an hour in the morning and half an hour in the evening. And also encouraging the parents to take the child outdoors, because that there have been lots and lots of studies which tell that the time spent outdoors and the child, when the child focuses at far distance, it helps in prevention and even the progression of the myopia. So that is important. Apart from all these things, I think even a good healthy diet and good sleep and regulating the sleep also is equally important. And apart from all those things, some just simple lubricating eye drops can also help tackle this problem.
Yeah, funny that you told about outdoors. it used to be so natural for us when we were children to play outdoors. It used to be taken for granted. As soon as we finished the school, nobody had to tell us we would run out of the house. But now, it has to be made as a therapy or a treatment part. And it appears very funny that, we have to recommend children, please go play outdoors at least 1 hour a day. But then you're right, outdoors do help not just in digital strain, but even slowing down of myopia. That's one of the very important part of recommendations which have been published and very, very well studied. That children who spend more time outdoors tend to have lesser progression of myopia, and now the digital strain also. When it comes to the adults, the treatment from my side, usually what I would do is I do tend to give them some lubricants. And these lubricants I ask them to use especially when they are working. Then the second important point is where I ask them to take frequent breaks from the computer. Not long breaks, but very, very short breaks. So when we talk about breaks, the immediate reaction that most people who work on computers, they come up with the immediate statement saying, no, I can't take half an hour break. We don't need those half an hour break. We need, in fact, half a minute breaks, about 30 seconds, but more frequent. So 30 seconds is, you just close it for a short while, already 5-10 seconds are done. So such short, ultra short breaks, maybe about every 20 minutes or 25 minutes, they go a long way in relaxing.
The commonly told 20-20-20 rule.
Yeah.
Every 20 minutes, look at something 20 meters away for 20 seconds. That really helps break the near focus and also giving relaxation and time for blinking. So blinking and blinking. I always tell my patients, just blink more frequently, and it should be a complete blink, because it has been seen that when we are looking at the screen, whatever blink we make also, which is an infrequent one, is also an incomplete blink. So that is a very important cause for the dryness what happens. And also it causes the clogging of the oily glands. So if I keep all my other secretaries, they also would be laughing, like I feel that everyone I am just telling frequent and complete blinks, and the 20-20-20 rule to be followed, and good sleep and regulating the screen time, and whatever work has to be done on the system has to be done, but apart from that, regulate the screen time. And good healthy diet is another most important thing.
Yeah, I think that covers up quite a lot. Blink, of course, is important, but then since it's like largely a involuntary movement, I think some of the times we may remember to do that, most of the times we fail to remember that. But I think taking frequent breaks helps a lot. And even probably one other tip can be dip a cloth in water, squeeze it, and then keep it over your eye. Not only does it relax the muscles, it also moistens the eye. So I think all these probably should help a lot. So I think in brief to put it, lubricate the eye, take frequent breaks from the monitor, cool packs, good sleep, good food, and blinking if you can remember it. I think these should be the mantra to relieve or have some relief in digital eye strain, which probably is now almost universal.
Yeah. And another important concern regarding this digital eye viewing is the development and progression of myopia in the young kids. So continuous focusing at near distance can cause myopia, and kids who already have myopia can have a
worsening of myopia. Yeah.
So that is
I think that's been very
concern.
A nice discussion what we had. Thank you so much for having made it. Thank you.